IRadimed presents IV Infusion Pumps in MRI, a safety and compliance guide video. For every MRI environment, compliance starts by asking these important MRI questions. Which IV pumps are you using during MRI exams? Are your IV pumps out of compliance with Joint Commission? Are you violating your IV pump manufacturer's safety warnings? Why is the Joint Commission and your IV pump manufacturer warning you? Each of these 7 patient and staff safety risks must be considered. Inaccurate IV infusion flow rates, ferrous projectile injuries and damage, missed critical alarm events, patient code response delays, IV extension occlusion hazards, excessive post-occlusion boluses, and hospital-acquired infections or HAIs. These hidden compliance and liability risks may lead to Joint Commission noncompliance, breached standard of care, and increased liability exposure for patient injury, staff injury, and equipment damage. Let's take a tour of a typical MRI environment, and in less than 3 minutes, we will show you how to improve your MRI patient safety, staff safety, and compliance. As we move through the MRI, you will see inadequate ability to hear or see IV pump critical alarms in all areas. The door restricts IV medication flow and may result in significant medication delays. IV pumps are not FDA cleared for MRI use, which can result in erratic infusions and projectile risks. Obstructed view of IV pump prevents ability to monitor the infusion status. No direct access to control high-risk IV infusions during the MRI procedure. IV tubing on the floor presents tripping hazards for patients and staff. Rapid response scenarios can experience significant delays and complications. Excessive medication waste of critical drugs from longer tubing priming volumes. IV tubing floor contact and multiple connections increase HAI potential. And finally, flow rate inaccuracy from tubing length outside the manufacturer's specifications. Now that we have seen an MRI full of compliance violations, let's take a look at an MRI that has the compliance violations resolved and non-magnetic IV pumps made for MRI in use. Non-magnetic IV pumps in the MRI Zone 4 are immune to the MRI effects. Uninterrupted therapy throughout the entire MRI exam increases throughput. Delivering IV medications at the MRI table improves clinical workflow and safety. Recommended IV tubing length ensures flow rate and alarm accuracy. IV tubing is off the floor with no extensions, reducing HAI exposure. Critical medicines are preserved, which complies with the ASA and ASHP drug reduction guidance. Continuous infusions during patient code response and interdepartmental care. Real-time audio and visual alarms at patient bedside and control room. There is a clear view and immediate access of critical infusions from the MRI control room. And finally, wirelessly control multiple IV infusions from the Zone 3 control room. In conclusion, non-magnetic is compliant. IRadimed's non-magnetic design allows for our flagship products to operate safely in ultra-high magnetic fields, which eliminates the need for long lines and other workarounds used with traditional infusion pumps. For more information, visit www.iradimed.com or call us at 407-677-8022.